Hi, Ananta.
Ready to start, Nancy?
Are we? Uh,
Are you ready?
yeah, I am ready.
Okay.
Okay. Should I start?
Your video is not on.
That is okay. I'm in the mobs.
I think we have to wait because Dr. Vijay and Dr. Suresh Kattaraj has joined.
Okay. Okay.
Nancy, your video is not on, I think.
Ananta, I have to just a second.
No, dear, we can see your slides. Just your,
I
yeah.
know because I have to just rush back to the lab in
Then.
a few minutes. That's why.
सिक्स ट्रेनिंग का क्या स्टेटस है
Ananta, we can start now, I think. Ananta, can you hear me? We
Yes,
can
sir.
start.
Yes, sir.
Dr. Charu, Dr. Shukla is also there. You can start with them. Okay.
Okay, sir.
Sure.
Good evening, everyone, and a very warm welcome to today's webinar.
Can you make it full screen, Nancy?
Sorry.
Can you make it full screen?
Okay. Sorry.
Thank you.
Visible?
Yeah.
So good evening, everyone, and a very warm welcome to today's webinar. Today, we are trying to do something new. As you know, iHERA has over the year built a reputation for something rare in this field, the courage to present science in a way that haven't been tried before. So, if, as you are also aware that in the recent conference also we have introduced Panchayat, a format that asked our community to engage with reproductive medicine, not as an audience but as participant. And today, iHERA brings the same spirit forward in the form of gamete controversies, debating the evidence. So, without taking much of your time, I would like to start with introducing our founders and co-founders, Dr. Ved Prakash sir, Dr. Charudat Joshi sir, and Dr. Sanjay Shukla sir. And me, Nancy, and Dr. Nidhi Yoshita Tanwar and Dr. Ananta Lakshmi will be your co-conveners for the today's session. Uh, thank you so much. Uh, this is the very first episode of the new series called Gamete Controversies, Debating the Evidence. And since this is our very first episode, let me take a minute to explain exactly what this is before getting into anything else. So, Gamete Controversies is going to be a series where we take one practice from the reproductive medicine or ART and something actually which we use in the lab and clinic every day, and open it up for the real discussion, not as in lecture, not as in debate where someone loses or wins. It is just a genuine conversation between the people who works closely with the science and about the things we don't always get time to sit and talk through properly. So why we are having this conversation? Because we want to explore everyday practice in reproductive medicine that deserves to be uh, that deserves scientific discussion now, and examining the areas where practice varies and evidence is evolving and conventions are questioned. With this series, we will try to bridge the gap between clinical practice, scientific evidence, and expert experience. So, for today's discussion, we have expert group of scientists with us, and to help who are going to help us think this through. And we are joined by four scientists who have been spent real time working closely with the exact questions. I We have with us Dr. Lote Strawback, Dr. Andrew Thompson, Dr. Suresh Kataria, and Dr. Vijay Chalur. Dr. Lote is founder and CEO and CSO of ARTS Media, Denmark, and she's also guest professor at Estonian University of Life Sciences. Ma'am, I want you to please join the panel. We have with us Dr. Andrew Thompson. He is Chief Scientific Officer at Twig Fertility, IVF SAS Limited, and Bridge Clinic. Then we have with us Dr. Vijay Kumar Chelur sir. He's consultant clinical embryologist with the experience of over 14 years, and his experience in handling installation of instruments, IVF laboratories, etc. And Dr. Suresh Kataria. He is director of Asia Pacific Institute of Embryology and scientific director, Pearl Singapore Fertility Center and Research Institute, Chennai. I want all the panelists to please join us. So I have with me as co-moderator my dear friend Dr. Ananta Lakshmi too. And we will be starting with where all the standard came from, because we are going to talk about media aging today, that what is culture media aging and what are the terminologies which are being used in the culture media during the discussion of culture media aging. So I would like to start with a very basic question that is often been untouched, which is how do we define these small terminologies which we have? So I would request the panelists to please uh, switch on their cameras. Hello. Uh, So, Dr. Lote, would you like to start with the definition? What is the expiry date? What we understand from shelf life? What is closed while stability and post-opening stability? Like one by one, can you please take us through this that we should be also able to differentiate between all these things?
Yes, thank you very much for inviting me today. So this is one of my favorite topics because we see a lot of debate and a lot of myths. So it's a very good topic to get some clarification on. So as a media provider, we are regulated very heavily from notified bodies in order to get FDA and CE mark. That means the media shelf life is determined by rigorously testing. So it has to be exactly the same on the last day of the expiry date as the first day. So there should not be such a thing as media aging if the vial is closed. It should have the same pH, the same osmo, same MEA test, and obviously maintain sterility. That is at least also what we see in our productions. We have an additional bovine embryo assay test, which is more sensitive. So I hope that will stay the same for all the media that you have. And then the next thing is post-opening is a big topic. So the things that will affect media is in particular infections introduced by the lab that you can have in theory happen the very first day, but you can also have the media for 3 weeks after opening without it getting infected. Then it depends how fast you handle opening and closing the bottle. And above all, that you do not aliquot, because that is compromising osmolarity, pH, and increasing the risk of introducing infection. So pH is not so critical when it's a bicarbonate buffered media, because that will reach its correct pH once it's in the CO2 incubator. However, a HEPA's buffered medium is also bicarbonate buffered, which means that it will not maintain pH indefinitely after opening. I think these are some of the key characteristics. So pH, osmo, infection.
Absolutely. Ma'am, can you please tell us how are these shelf life actually achieved? How do we reach these shelf lives? Like, how do we decide that this is going to be the time frame?
Yeah, there is described from FDA and MDR very detailed stability test protocols. So you will do different time points. If you say, like, if we claim 24 months shelf life on our culture medium, then we start out by testing every 8 weeks, then every 3 months, and then every 6 months, and it'll be the same tests as for release. And that is pH, osmo, sterility, fungal growth, bacterial growth. And then we will add, in our case, the bovine embryo assay control, but then obviously the MEA test is part of this. And again, the results should be exactly the same. Then some have the additional test, like we do as a transport stress test. So it means we challenge the media at, we store it at 37 degrees for 14 days. And then we do the same release quality control measurements. And then we can claim that our media are stable after 37 degrees, 14 days. And that we do on the right after manufacturing, but then again also, for instance, 22 months or 23 months prior to expiration. So that's additional tests you can do, but you need to do these tests in order to claim anything you do. You need it has to be backed with very rigorously testing.
Mm.
Actually, one more thing I'd like to mention is that if you see older media registered longer ago, you will see that it says the media can be used for up to 7 days after opening. But like I said, in theory, you can use it up to 3 weeks, all depending on how you handle it and how stable and robust the raw ingredients are. But many new media that have been registered the recent years do not have this. They stay for single use. It doesn't mean that they got weaker over time. It's simply a question of economy and work, because it requires a lot to have this claim to be used 7 days after opening. You need to do usability tests and some very costly and lengthy tests in order to put this claim on the new registered media. But it doesn't mean that you can't do it. We are, as media manufacturers, just not allowed to claim it unless we do these testing. So you won't see many newly registered media with this claim anymore.
Oh,
Hi,
okay.
Nancy, this is Sanjay. Nancy, can I interrupt here?
Yes, sir.
So I would love to know, according to you, which ingredient in the culture media, particularly, is the most labile or fragile one that decides the medium is no more or no longer can be used?
That is a very good question, because it all depends also on the source. So you'll say sodium pyruvate is sodium pyruvate, but it depends on the source. It used to be that we'd have ammonia buildup from the old sources, but today it's I think all of the ingredients are pretty robust. It's more that if you have a plastic bottle with a screw cap, then it will not keep tight for so long. Then you lose sterility at some point. So it's more practical things like that than actually one particular raw ingredient. So if it's now you're talking about culture media, but if you talk about hyaluronidase, there is most are inactive after 12 months, but that's the enzyme. That would be a breakdown.
Continue, Nancy.
Dr. Andrew Thompson, sir, are you here?
Yes, sorry.
Do you
Thank
want
you.
to add something?
Thank you, Dr. Strobeck. She's the authority on culture media. One of the things that I was going to talk about was this difference within some of the newer media, say single use only, which provides kind of logistical challenges compared to the older media, which says that they're valid for up to 7 days after opening. Or I guess the kind of approach that I would take with that, particularly in the Western Hemisphere, is where do clinics stand on a liability point of view? If you have a culture media that says it's only suitable for single use, and you're still using it 7 days later, and then a patient gets some sort of contamination within her embryo culture, and for whatever reason the patient decides to sue the clinic, and then it finds out that we're still using media after it's licensed use, where do we stand as clinics? And I don't think that's ever really been explored in the public eye before. So it'll be interesting to see how well these things kind of get challenged as and when they arise, particularly for the single-use media. I tend not to use it because they say specifically say, only valid once opening it. And some of these bottles are quite big, we're talking 100+ ml of media. The question I probably get asked the most is how long can we have oil open for after we open it? And we generally say 2 weeks. Some clinics I've worked at, we say 4 weeks. There's sort of no universal agreement, but we kind of fall back to reflecting what the manufacturer's specification is. So we have some media which says, we can open it for 7 days and it expires on this date. The kind of the other angle that we've looked at is some of the clinics I've worked at. If you open it from 7 days, if you're then doing it in 3 days culture, some clinics will approach that as you can only use it up to 4 days after opening, because when you do the culture change, it takes it to 7 days. Whereas other clinics will still be making new dishes up until the 7 days and then disposing it on 7 days. And we've seen that recommendation both ways based on some of the manufacturers. So Origio, we were given very clear instructions. You know, if you're doing a media change, it's 7 days. So don't open any new media after 4 days. And other medias like Vitrolife, they're like you can open it for up to 7 days afterwards and use it. So it would be interesting to hear about the different approaches that we see kind of around the world and how people define their own expiry dates. And I think that will vary clinic to clinic as well.
So we really sorry. So now that we know that what is the expiry, shelf life, and closed vial stability, briefly we know now all four of these things. Now let's move towards the actual things which we are going to discuss today. So supposedly we have two centers which been using the same exact batch of culture media. For example, a center A, it opens a bottle every day, which you just mentioned, but it's like it will give a more clear picture to the delegates who are listening. So once the bottle opens the bottle every day for 7 days and uses only small volume each time, and the bottle is being exposed to air rapidly by uh, discarded on day 7. And by the center B, the bottle opens only twice, and it was stored correctly at 2 to 8 degrees Celsius between the uses. But they use the same bottle until day 14. But there was written that it should be used within 7 days, or after opening, it should be used only within the 7 days. So, out of these two centers bottle, if you have to use for your culture, which bottle would you trust? A or B? First, just one answer. Is it going to be A or the B one? Everyone. Suresh, let's start from you.
Comment a little bit. I didn't have a chance to talk about this shelf life of this stuff. We have time, like, say a few
Sir,
things about that.
you're barely audible.
I was just wondering if I could talk a little bit about this shelf life.
Yes.
Because I didn't have a chance. I mean, they didn't ask me about that. In any country, for example, when you manufacture a medical device, it is a requirement first, to test the shelf life. Now, when we say shelf life, it is the content of the product. Actually, say for example, if you look at, are you able to hear me?
Yes, sir. But your voice is little. There is a little disturbance in the voice, so I'm not able to actually understand what you are trying to say.
Let me connect with my phone. It's probably
Okay, uh, by then, I think Dr. Vijay Chalur is also here. Sir, would you like to say something about it? Which bottle would you want to use for this one?
It would be definitely bottle B.
Bottle B.
That's my
Okay.
strategy. I don't prefer to, in the very first this one only we aliquate and keep the rest in this one, and we keep it in small aliquates, and we open only one portion at a time, so that we can have safety. Not every centers we will be having HPLC and other things to check the stability of the medium. So here it is better to go for a safe one. So aliquate it properly when the first you open it, and store all the things there and take out only required amount of the media aliquate. That's my principle. So it will be obviously center B.
Okay. Dr. Suresh?
Yeah, I was talking about this, stability test, earlier. Any regulator requires when you manufacture something, for the first time, they would like to know the stability of the product to determine the shelf life. And as one of the earlier speakers, spoke about that, we need to see, what are the components, the culture medium contains physiological salts and other components. There are 3 or 4 components which are temperature sensitive. So what they do is that, in order to give the approval, you have an accelerated, testing method, which, within a month, and then, regular real-time testing. So maintain that at different temperature. For example, culture media, which is maintained at 2 to 8 degree. You keep it, for a month, and then, as I said earlier, you test, 3 months, 6 months, and 12 months. And then you test the component, each one actually, whether they are stable at that temperature for a longer period, how long it is stable. And then you determine the shelf life. Having said that, again, you can maintain the product at a little higher temperature, say for example, 15 or 20 degree. If you test the same product, it will have shelf life much shorter than this. Why it is important? During transport and shipping actually. Now many centers receive culture media. You're not sure actually whether the temperature has been maintained at that temperature. So that's why usually when culture media are shipped, they insert a data logger in that actually. You can, with a USB, you can connect to your system and then see how long the temperature has been maintained actually. There are situations where in certain countries the product is not cleared immediately and they don't have a cold room to maintain that. So it takes a couple of days to get the product cleared. There can be a compromise. I'm not saying this, that there may be situations where the person who is receiving the product, if there is no data logger, he may deliver the product to the center with all the whatever cold chain maintained actually, but there might have been a compromise during the shipment actually. This is something to be looked at actually. Secondly, what normally for a medical device they look at is actually stability, means whether after a certain time whether the product is still sterile, whether there is a endotoxin in that product after keeping for a prolonged time. Taking together all these things, then you determine the shelf life of the product actually. So when you say expiry, it is from the date of manufacture, including the shelf life. Say for example, you receive a product with a expiry date. By the time it reaches you, probably from the time of manufacture, 15 to 20 days is already gone actually. So your product is not 4 months, say for example, any particular culture media is not valid actually. It's 3.5 months actually. Secondly, post opening actually, what we are concerned, we have seen actually when culture media contains phenol red as a pH indicator, you do see repeated opening and closing can change the pH, and such media takes longer to equilibrate when you culture under oil actually. Secondly, there is a risk of contamination. So what happens is, it again depends on the embryologist. Is knowledgeable enough to understand how to open and close. I have seen, many times, the cap is not properly closed, not tightly closed. Then there is, air entry into that. There can be contamination. There can be change in pH actually. This is something, I just wanted to tell.
So there are some great tips, sir, for the young embryologists. Dr. Lode, do you want to, which center media would you like to choose from these?
Yes, it was a bit difficult to understand in the beginning, but again, for determining the shelf life, it's a very regulated area that we have to follow some very strict protocols. And we ship globally from Denmark, so it is not uncommon that sometimes it takes a little longer than the ice packs. And that is why we did the shipping temperature stability stress test, which means that it's actually, in at least the raw ingredients we use and the vials we have, it's not sensitive to higher temperatures in the way that you can store the media at 37 degrees for 14 days and then do all the tests required, endotoxin, fungal, bacteria, MEA, pH, osmo, in month 23, 1 month prior to the expiration date, and still get the exact same test. So it is maybe some in other vials with other raw ingredients, it is detrimental by higher temperatures. But we have tested to make sure not having to discard media if something happens during shipping. It's stuck in customs. So and I will say the whole labeling procedure to state the expiry date is very highly regulated as well. So the day it's manufactured, that's when you determine the expiration date. So if it takes a week to ship and 2 weeks for the quality control testing, it still had the expiration date added to the label the day it was manufactured.
Ma'am, I just wanted to understand that once it's been open, so the thing is that is fine that the expiry date is one thing, that this is the expiry date which was given by the manufacturer. We are going to follow that. But once it's been open, how many days it is? The case is here that the manufacturer says that this bottle can be used within 7 days. Okay. After opening, you should use it within the 7 days. But in one center, it's been used every day for 7 days, and in other center, it's been used only twice. But the time, they are exceeded. Days are exceeded. It's now 14 days. It's been 14 days. Should we use that media which is now extended the date of shelf life on the post-opening shelf life?
So in our bovine and animal work, you can use the culture medium up to 2 or 3 weeks. What is important is how fast are you when you take it out of the refrigerator to aspirate the media you need and put it back in? Is it out for an hour every day or just 5-10 minutes? I think that is important to distinguish between the two. And then what determines it's out of the manufacturer's control what happens in the lab. It's all the handling. Are they introducing new infection? Are they handling it for too long? Because if it's for too long, then the water will evaporate from the media every time if it's put on a heated plate and sitting there for too long. And then you will slowly increase osmolarity over time, and that cannot be bypassed. pH is not so critical, only as Dr. Suri says, it may take longer when you incubate it to CO2 equilibrate.
Okay.
Can I add something here?
Definitely, sir.
Yeah, see, probably, it is due to regulation, or there may be, some other, reason, but, use it after opening, 7 days, and then don't use the media. It again depends on the person, who is handling the media. Firstly, if I'm the embryologist, if I'm careful, I will, say, for example, you prepare the dishes on the laminar flow. And if the temperature is on, usually when you prepare the culture dishes, the laminar flow workstation must be switched off, actually. It should not be, hot. I've seen, some embryologists, keep the bottle on the warm, laminar flow workstation. And, you are kind of, increasing the temperature. If it sits there for longer, you are compromising the temperature. So if it is a cold surface, you take out what is required and then close it, keep it back. One thing what we notice, if the medium is, added with the pH indicator, phenol red, you do see over a period of time, actually, the color changing. If the color changes, and if you, if it the media turns turbid, then you know that there is contamination. So as long as these two doesn't happen, I don't think, there has to be a restriction on the 7-day, deadline, when you open the media and then use it.
Absolutely. Dr. Andrew, would you like to add something to it?
Yeah, I mean, for me, bottle B would be the better option, and that's simply for the risk of contamination. In center A, if you're opening it repeatedly, that's multiple hands, it's multiple, the risk multiplies going through every single person every time you open it. You're exposed, depending on where you open it. If you're opening it in a workstation, class 1, class 2, the risk will be reduced somewhat. But if you're opening it in, ambient air, you have that risk of contamination from the air repeatedly every time you open it. So even going with bottle B, even going past, the 7-day manufacture thing, the fact that it's only been opened twice, it's only probably been touched by 2 people, the risk of contamination is going to be much less in that scenario.
Now, I think we know the answer for this one, though it's more on how embryologist handles the media than the actual shelf life which was written there. So now let's move toward the second.
Can I add just one comment? For
Yes,
for
yes.
dish preparation, I would always choose to have a designated area for that with a cold stage, not a heated stage, and I would always have the laminar flow on, because whenever you open the bottle within the laminar flow, that's where you have your own sterile environment. Once the laminar flow is off, you risk introducing infection.
Absolutely. So even the evidence says the same thing, that we have to be very critically careful with the shelf life, and it depends upon the various compositions that how you are handling the media, how you are taking care of the pH, how you're taking it out of the refrigerator, and how much time you are actually taking. Now, Ananta?
So we have conducted a poll in our group, WhatsApp group, regarding this aging of media. In that, we have asked about, should IVF laboratories establish a universal maximum open bottle period for a culture media, regardless of manufacturer? So this is what we are discussing about previously, I think. So as all the experts told, it is not about the day specific, it is about the handling by the embryologist. Here, every participant who has answered the poll, majority of the participants, I can say, they preferred the answer yes. Yes, we should establish the maximum open bottle period for all the culture media, regardless of manufacturer. And few participants felt that it should be manufacturer specific. So, according to the experts' view, also, we have came to a conclusion that it depends on the handling of the embryologist, not by the specific period mentioned. So I think we got an answer for this.
Yes. Now, moving towards the second trouble, which is mostly we have already discussed a little bit, but the small volume IVF laboratories often face a practical challenge. Even the smallest available media bottle may not be fully utilized within the recommended in use period after opening. And in these settings, would you like to recommend aliquoting as routine practice? If yes, then why? If no, why not? First of all, just yes or no. Would you recommend this practice or not?
Yes, I recommend this practice, but in what you aliquate and how do you aliquate is more important, and how do you store the aliquated bottles back into your this one is more important rather than aliquating itself. Number one. Number two, you need to be sure about your refrigeration conditions and other things. And once you do the aliquating, then you have got to also have a thinking that the media is already opened. The safety net is open. So you cannot use it beyond 2 or 3 weeks.
Okay.
That also you have to keep it in your mind.
My answer is no, because when you freeze and thaw, there are certain components which may undergo degradation, and it may affect the performance of the media, unless it is for some other purpose actually. So I don't think particularly embryo culture media should be frozen and thawed and then used.
No, it is not freezing, sir. It is stored at 2 to 8 degrees. Open once when you get the bottle, and immediately aliquate it. Keep all the aliquates into
but it has a shelf.
Refrigerator.
It has an expiry date.
That shelf life cannot be more than 2 to 3 weeks because you have opened the bottle.
Okay.
Because you have opened the bottle, the shelf life ticks in, and that cannot be more than 2 to 3 weeks. but you take out only required amount of aliquot so that during that shelf life period, at least you can safely use it.
Okay, then
But
my
this,
question is, how do you aliquot them actually? Where do you put them? The
actually,
aliquots?
we have small vials available,
Yeah.
3 ml vials available with screw caps.
Yeah, but
Gamma
have they been
supplies.
tested for
Yes,
endotoxins
yes,
and other
yes,
things?
yes,
There
yes,
is a
yes, yes. They
concern.
are available. They are available. That's what we use. So you put them into it. I used to use a 5 ml one. Now we have shifted it to 3 ml one. So you just put it into that, screw cap it, keep all the liquids, mention the date of opening and max used by date on them, basically. And nowadays, most of the media manufacturers are coming up with even a 10 ml bottle. So I think that would be better to switch over to for a small volume IVF laboratory.
Because there are centers which are hardly doing 2-3 cases. So sometimes
See,
coming
even
in
if the person is doing
also,
3 cases, about 3 ml per case, roughly around about 10 ml is required. So they can purchase 10 ml easy.
yes.
Bottles are available. 10 ml packages are available. I do understand it is a bit expensive, but
Yes.
they are available. Because
So
only after I started searching out for the small aliquot bottles, I started noticing as the volume decreases, the storage volume decreases, the price hikes.
yes.
It's practically 20 rupees less than a 120 ml size bottle.
Uh,
Hello,
Dr. Lo-
Nancy.
Yes, sir.
I have a point here,
Yes, sir. Yes, sir.
especially specifically for the low volume laboratory. It is related to cost because they are worried about the cost. But the cost is more if you lose your 2 or 3 cases that you are doing if something goes wrong. So the cost of the medium is still cheaper if you discard the unused media and get a fresh bottle of medium for the remaining ones. So you have to balance that. I think it is more important for them to understand that the peace of mind is more critical, more important than just a few bucks of, you know, uh, medium.
Absolutely. Dr. Loden, any
So
comments on that?
yeah, if I look at the vials shown behind that you aliquot into, I doubt those are mouse embryo assay tested. They look very similar to vials we tested that are embryotoxic. I used to do a lot of testing on these vials because we in the vet industry, we have a HEPA's buffered maturation medium, which allowed us to do ovum pickup of different species far away from the IVF lab and then do the maturation in HEPA's buffer without the CO2, but just being heated for up to 24 hours. And then after we introduced this HEPA's buffered maturation medium, some labs were extremely happy and some were very unhappy. And it turned out it depended very much on the vial used and the volume of the vial. So the more dead space, the more detrimental. So we did a lot of tests, aliquoting media into different plastic vials. And then after just 1 hour of medium in the plastic vial, we would use that culture medium in tests compared to if it came right out of the manufacturer bottle. And storage of media just for 1 hour could do significantly lower embryo rates. So for that reason, that is one I'm not a fan of aliquoting because the mouse embryo assay vials are often 10 milliliter, and that gives you a lot of dead space, which allows for evaporation and increased infection. The other thing I heard was freezing. I believe it's important to follow everything on the labeling from the manufacturer. I don't think anybody recommends freezing media today. If our media is so getting too warm is not a problem, but actually getting too cold is a problem. If it's just below 2 degrees around freezing, what you will see is precipitation, and that is often HSA or gentamicin. And then you will have these floating precipitates, and they won't be available in the biological way it should be. So I'd be critical of freezing, but all small cryovials, they haven't been tested, mouse embryo assay tested for storage of media, and they add a toxic component to the media over time.
Okay. Dr. Andrew, what do you want to choose from this?
I mean, as Dr. Strobeck said, a lot of the vials that you aliquot into are not mouse embryo assay tested. The ones that we can do, there is a 5 ml tube, which we know is mouse embryo assay tested, but those in themselves are very expensive. And often the cost of those outweighs the benefit. So I'm not personally a fan of aliquoting, just because although it looks like you're wasting a lot of media, you can, as someone else said, you can get the media in smaller volumes, smaller use bottles. The manufacturers are certainly going in that direction. So I'm not a huge fan of doing it. And obviously, if you're putting in 1 ml into a 5 ml tube, then there is that risk of evaporation. You know, you're going to have a lot more evaporation from, I don't know, 10 1 ml tubes than you are having 10 ml in one bottle. So essentially what's already been said.
So for aliquoting, it is, if you want to use, it should be MEA tested, and mostly you should not use it. If you want it, you have to take the smaller volumes of media bottles. You can always call for. Now let's see what the evidence actually says. Evidence also pretty much says the same things, that if you want to use it, you have to be very careful during aliquoting. The area should be sterile. You have to use the ependoffs or the tubes which are MEA tested, and it's pretty much a very hassle to achieve that. And now moving towards the poll, let's see what are the perspectives of our practicing embryologist. Ananta?
Yeah. We had the poll on the same question. Do you aliquot media immediately after opening? So this was the question. Almost a majority of the participants have answered that it is always we do aliquoting, but sometimes was answered by few participants, and very few participants answered as never. So according to the expert opinion, it is always better to get a small volume bottle than aliquoting. This is the take-home message from this session. And if you are very fond of aliquoting the media, you have to be very careful in doing that. And many experts feel that it is always unsafe. So better to avoid that. That is the conclusion from this. Let us move on.
Yes. So now after this, there is a routine IVF practice. Culture media may undergo multiple warming and cooling cycles. As warming and cooling, I mean, like we take it to the take it out from the refrigerator and then again taking it into the refrigerator, not freezing and thawing. So warming and cooling cycles as bottle are rapidly retrieved for daily use based on your experience and the available evidence, which is likely to have a great impact on media integrity, repeated temperature fluctuation, or repeated bottle opening and handling. How should laboratory define an acceptable limit, if at all? So we have
Nancy, both your statements, repeated temperature fluctuation. When you take it out of the refrigerator and put it back also, there will be temperature fluctuation. And
Yes,
to
sir.
use will obviously be opening. So both have the same effect.
So sometimes, sir, some people have seen that they used to take out media on the temperature stages. They don't take off it. We are just trying to like discuss this in a manner that
That's
they
where
will
I'm
also
saying.
learn.
That's where I'm saying. Take it out of the refrigerator and put it back into the refrigerator. This is called as temperature excursion.
Yes.
There is an excursion, thermal excursion, and to use it, you will obviously be opening the bottle. So it is opening and handling, you have made it. So how much time you have kept it, how much excursion you have attained it, and that's what depends on the stability. A roughly 10-degree rise in the temperature or excursion of 10 degree will increase the activity of dissociation of the stable components by almost 2 times faster. So you have 5 times doing this particular exercise in a particular week's time, the 5th day opening would have already lost roughly around about 50% of the efficiency of the medium in terms of stability.
Okay.
So these two are common. It is temperature excursion and opening and handling. No matter how much minimal time you have taken, what you have done, you have exposed it to subnormal conditions.
So, according to you, what should be the acceptable limit? Like you said, 5 times it. So is it okay to open it 5 times and then?
Say, this is what is the judicious thing with which you will have to do with aliquoting and other things. It counts back to the same. So have the smaller volume media, only expose it. You take it out, put it on a cold state. If you want to prepare a dishes for the next day morning, prepare it with a cold media on a cold stage. Keep that for incubation, and unused media also should be kept in the incubator right at that moment only, and utilize that within 2 days of incubating maximum, so that the other things are there in the refrigerator safely sitting. You have to strike a balance.
Okay. Suresh?
It appears like, it's kind of, overlapping with the previous question.
Yes, because
Yeah.
the
So
indicating
what I
question
see
was
is
the-
actually, like when we say, media should be stored between 2 to 8 degree, it's a range, that is given actually for culture media. Now, each center, the temperature that is set and that is achieved is different actually. It varies from lab to lab actually, or within the same center. So that's why, like as part of the QA QC, the first thing in the, morning, you check the temperature actually. So you record the temperature every day, and then in your plot a graph, you see, whether your fridge is stable or not, in the first place. Suppose, your temperature is around 4 degree, though it is the range is 2 to 8 degree. Then when you take it out, as suggested by Dr. Vijay, ideally it is better to have a bottle which is a smaller volume, say for example 10 ml. And then, like you set up everything before you take out the tube, and then take out whatever is required and then put it back immediately. That way, you reduce, the temperature fluctuation to a large extent. Can, repeated opening, closing, all these things can be reduced.
Nancy, you're muted. Unmute yourself, Nancy.
So we have discussed this in the previous question also, that there are you might see in precipitation commonly when the media is being exposed to the temperature like this. So the temperature and pH fluctuations during storage and handling may cause a lot of problems. So it's very important to take care of the temperature when you are taking it out. There are different ways of doing it. People try to use different methods to reduce the time which they are in which they are taking it out for the next day preparation of culture media. So now let's see what the polls for now let's see what the other evidence talks about it. If there is repeated exposure to temperature fluctuations during handling and storage, it should be avoided to preserve the product integrity, as suboptimal storage conditions can lead to degradation of the media component, potentially impacting embryo development. It was also given in the ASHRAE recommendations of good practices. So the lesser the time, the better the outcome you will get. Now, moving towards the next question. Ananda, do you want to take this question?
Yes, Nancy. So the next scenario is embryologists often rely on pH osmolarity or occasionally a visible color change, as expert was discussing about the phenol red containing media as indirect indicators. Nancy, the next slide. Yeah. Indirect indicators of media quality. However, many culture media provide no visual warning of deterioration. In your opinion, do you currently have any reliable laboratory assay or surrogate markers that can detect media deterioration? before embryos are exposed? Or are we still largely dependent on manufacturer validation and strict adherence to the storage and handling protocols? I want an opinion from each of the experts. To start with, Dr. Suresh sir, you can take this question.
I think you have to rely on the manufacturer's indication. Having said that, as an embryologist, you have to monitor the pH osmolarity. Of course, you will not be able to measure. Though, of course, if it is cultured without oil, there is a risk every 24 hours. There is a osmolarity change. That is something to be borne in mind. And any visible, like turbidity or change in color, those are the only things, as an embryologist in the laboratory you can monitor. And of course, you have to rely on manufacturers, whatever specs.
Sir, Vijay sir, your opinion on this, sir? Do we have any indirect test can be done in the...
See, the very purpose of adding phenol red to the medium was this, see, as a visual indicator of a pH shift. But you have to understand that phenol red, to show a deviation, it has to be in the range of 1 on the pH scale. Subtle differences to notice. If it is a larger volume, you will be able to notice much better. In a smaller volume, identifying phenol red color shift is, it has to be really troublesome. So one has to invest on a pH meter, a good pH meter. But again, the question comes up is, there are various kinds of sensors which are available. You have got to take a pH meter, standardize yourself for the use on the culture media for that. There are some very small volume, 50 microliter volume pH meters are available nowadays with biological sensors. There you have got to be very sure about standardized, regularly recorrecting or calibrating the pH meter for that particular purpose. That's a secondary trouble there. Osmolarity is altogether a different issue. There are two methods of osmolarity which we get up with. One is vapor pressure, the other one is the freezing point determination. If you want to go for a vapor pressure osmometer, that costs somewhere around about 9 lakhs in India. And if you want to go for a freezing point determination, that will cost somewhere around about 4 lakhs in India. Would you invest that much to test only? And again, the volume size comes up. In vapor pressure, you require at least 2 ml of the medium to test once. And when you come into this one, freezing point, it requires at least 250 microliters per test episode. And then once you get it across, how long you keep on testing, what all you will be doing, you end up into a web of, Abhimanyu entering into the Chakravyuha without knowing how to get back. Instead of that, stick to the manufacturer's instructions and have a good laboratory practice. Probably you will be saved better.
Thank you, sir. Thank you for your insights. So let us have the same question from Dr. Andrew. Your practice, do you do any other?
Yeah. With every new batch of media we receive, we get the certificates of analysis, which we record within the traceability system. Then before every new batch is opened, we do a test equilibration and then use a pH meter. Now, the pH meters come in various different qualities. So what we actually use is a blood gas analyzer. And a blood gas analyzer seems to be much more accurate than certainly the more cheaper pH meters, but they are obviously a lot more expensive. And when we do that, we also do a routine calibration. So we have known controls. So with predetermined pHs, so we can calibrate and make sure that blood gas analyzer is what we think is correct. And then we use that for every single batch of media before any embryo goes in it. So when we open a batch, we put in some test media, equilibrate overnight, then you take out the box of it to do on the blood gas analyzer the next day. And then based on what the pH of that shows, we either accept or reject that lot of media. So we do it about halfway through so that we know we have enough spare media should we ever reject it. It doesn't happen very often that we reject it. Now that the culture media is, made by industry, and, we're not making culture media in-house like the olden days. is a lot more reliable, it's a lot more consistent, but we still feel the need to do that internal validation for each batch, as well as the external validation.
Dr. Lote, you want to have this question? Do you do
Yes.
any test? Yeah.
I think
Yes.
it can be very difficult to do accurate pH measurement. And pH is determined by the CO2 concentration and the bicarbonate concentration in the medium. So if you trust the bicarbonate concentration in the medium, then you should invest your time in monitoring your CO2 concentration in your incubators, much more than measuring pH.
Apart from pH, if you use media without phenol red, do you do any other test for the validation of media?
Then it is in particular important to monitor the CO2 concentration, because you can only rely on that, and then you need to trust that there is in fact the bicarbonate concentration in the medium that is stated. So if the manufacturer says 6%, you should aim for 6%. We actually have 5 to 6%, because many experiments show that a little off pH is not going to be detrimental to embryo development. What is really critical is fluctuations, meaning opening and closing doors, taking them in and out for evaluation. That is much more detrimental, the fluctuations, than an actual suboptimal pH.
Thank you. Thank you for that. So from this, we have a conclusion that we are more manufacturer validation. We have to depend on that. Apart from the check of pH and the color change, we don't have any other tools to check with. There is no, without any options, we have to just follow the manufacturer validation.
Can I add a comment to the slide that you keep jumping back to? Because there's also, so it's good that we pay attention to where we can optimize, but some things have already been optimized that we don't have to put our energy into anymore. So most modern manufacturers, they do not use a glutamine source that will have an ammonium buildup. That is from a leftover from the very, very old times when media was manufactured. So that is not a thing anymore.
So we don't worry about the toxicity also, the breakdown toxicity, right?
Of glutamine. It does. Yeah. It used to cause ammonium buildup, but the glutamine sources that we use today in media manufacturing, they do not have this ammonium buildup.
So I have the question here.
And this is what is called alanine glutamine, which is stable at 37 degree, and it doesn't break down, to accumulate ammonia. Having said that, there is a small concern due to a metabolic activity of the embryos. There may be still, slight accumulation of ammonia, particularly when there is a prolonged embryo culture. But that is, I think, negligible.
Okay. So I just want to ask that question, sir. Suppose if you incubate the media and you are using it for a particular patient's culture, and if you are not having the habit of changing the media on day 3, you are having the same dish culturing till day 5 or day 6. Suppose if the media is left over, can you use the same incubated media which is there in the incubator for 5 days for another patient to start a fresh culture? So as you're telling that the degradation will be less, can you use the same incubated media for another patient's culture?
No, I mean, how, it all depends on how have you kept the media in the incubator, whether it is in a tube, whether it's in a dish, because even in, incubators, where the humidity is there will be still, changes in osmolarity. Every 24 hours there will be change. So there will be actually, osmolarity change, which will be, detrimental for the embryos. I don't think, it should be used.
Okay, sir. Thank you, sir. Do you have any?
Ananda,
Yes, sir.
I'm sorry to interrupt again and again, but I want to reiterate this statement of mine
Yes, sir.
many a times, that if your clinic or center is so poor that it cannot afford a small amount of medium, you should stop practicing IVF.
Definitely, sir.
Right? these questions are absurd to me. I mean, I cannot tolerate such things. If you're, by chance you don't have a medium supply and those things, again, if you are not observing the basics of good laboratory practice, that your inventory people are, recording when your medium is going to exhaust, and they are not ordering in time, you should not practice IVF. So these
Absolutely.
questions don't arise if you are observing those things very meticulously. Then only you can succeed in IVF.
Thank you for that, sir. Just to re-emphasize that we should not use, I have asked this question, sir. Thank you for your comments, sir. So let us move on to the next one. We have discussed whether there are any tests that identify media deterioration before embryos are exposed. Once embryos are already in culture, are there any early morphological or developmental warning signs that make you suspect the media may be compromised? Because we have a number of factors influencing the embryo development, which we cannot point out rightly. So, can you have any other features just to point out this could be due to the media change? In other words, are there subtle changes that appear before any significant decline in embryo quality or laboratory outcomes become evident? And Dr. Lote, you want to take this question?
I'm not sure I quite understand it, because I don't know what you mean by media is compromised. So if the media changes color over time while you're culturing, it's not a media thing, it's your incubator CO2.
Okay.
And if the embryos are not developing as they should, it could also be a temperature issue.
Definitely. So let us say the contamination of the media was ignored and they have started culturing from a turbid bottle, let us say a scenario like that. If there is any particular signs that you could see in the embryo?
If the media is contaminated, you see it with their turbidity, whether it's phenol red or not. In the veterinary practice, where you have some very valuable embryos, sometimes if you detect an infection, you may decide to continue and just change the media every day and still do a transfer. You will still get pregnancies and healthy offspring. But in a human clinic, I'd probably not have that as the practice. But then again, if you have a 2-year-old patient and there is just one embryo, I guess it would be up to the clinic.
Thank you. Sir, Suresh sir, you want to add on any points to this?
I think some of those things has already been pointed out. Visible signs where you see ability look under higher magnification, you might see actually bacilli moving around, which is like they produce toxins, particularly if it is a gram negative bacteria, endotoxins, which will definitely hamper the further progress of the embryos. So that is one thing actually. Now, if you don't see any contamination, and you don't see the embryos are not doing well, it is practically impossible to say in one particular situation. Now, if you have few patients in your incubator, embryos, and all of them are not progressing well, then there can be actually like few reasons actually. One is the incubator environment, where the temperature and pH might have affected, or the media might have affected. How do you rule out? Ideally, you compare with another media, sibling oocytes or embryo culture, and then if you see progress in one in the other, and then you will know that the media has been affected. Probably there is a manufacturing defect, though like whatever quality tests that has passed, still hasn't actually. Say, for example, if you look at biological test, which is mouse embryo assay, it doesn't reflect human embryo development. I mean, mouse embryos can grow in anything, but that's actually, industry practice where, you perform that and then, more than, 80% of the embryos should form blastocysts. So I think, generally, one has to be, alert, to see changes. There can also be, issues with the oil where, there can be, fungal contamination and then fungal spores, and there are toxins actually, which can actually, hinder the growth of the embryos, progress of the embryos actually. So there are so many things. Unless you are alert as an embryologist, you will not be, able to, to troubleshoot quickly.
Yes, sir. So, any add-on points to add on, Dr. Andrew?
No, nothing really to add. The only thing with contamination is that if it's a fast-growing bacteria, if you're using time lapse, it's sometimes obvious you see the bacteria replication and the bacteria growth before it has any effect on the embryos, and that obviously depends on what bacteria is in there. And some of the embryos are more resistant to different types of bacteria. So if you're using time lapse, you can sometimes see it starting to grow, and then it's just a case of changing media and trying to mitigate that growth, but very, very difficult thing to do.
Yeah, thank you for that. So if you have...
Can I add one thing to this?
Definitely.
Somebody mentioned incubator environment, and then if you're not using time lapse, if you have multiple media aliquoted in plastics in the actual incubator where you're also growing embryos, that could affect the actual environment.
Sorry, I'm not able to get it.
Sorry?
So can you repeat the
Yeah, so if you grow embryos in an incubator, if you're culturing your embryos, and in that same incubator you also have plastic vials with aliquoted media, that could affect or that will affect the environment. We did tests on this, having plastic bottles inside the incubator or even media plastic bottles, because they're mouse embryo assay tested for inside, but the outside and the outside of the lid inside the incubator will actually create a lot of VOC.
Definitely. Thank you for the valuable point. So the point here is do check out the plastics inside the incubators also, which could affect your embryo quality. So that is a valid point. Thank you for your valuable addition. So with this, we don't have any other specific embryo morphological parameter or anything to say that. So be careful, and we should be always be careful and while preparing the dishes and handling the media. We have to carefully monitor the pH, osmolarity, everything. That is the take-home message from this slide. So can we have the next question, Nancy?
Ananda, one other important point, which is probably Dr. Vijay's favorite one, is the composition of premixed trigas.
Sir, you want to add on anything, sir, on that?
I don't trust premix.
Okay.
Because
I don't trust premix.
Yeah, so what happens that if you have a brand new bottle of medium and your trigas cylinder has gone down below, 2/3 of the volume, the composition keeps on changing, and it is not the same that you had when you had changed the fresh cylinder of trigas. So it may affect the actual pH in the culture medium. Yeah, so that has to be kept in mind. Sometimes this happens that you are doing very well with your old medium and the embryos were doing very well, but then you had a gap of say 10 days, and then you had another batch of IVF. You are using a very fresh medium, but the cylinder is the same, and the cylinder level has gone down, and that changes the entire story.
Yes, sir. Composition of the media. So another valuable point here is try to avoid premix gases, or always check the composition. When it is full cylinder, it gives you a different outcome, and when the cylinder is half, then it gives you
You cannot check the composition every time if
exactly,
you
yes.
are using, and you cannot get it's a very strategic point. You
Yes.
cannot just get fresh individual gas and blending of those gases in your incubator. So if you are relying, your incubator is allowing only to use dry gas incubator, you will have to set a cutoff that, okay, after this much of pressure we'll change the cylinder, irrespective whether we are using it or not.
Not. Thank you for that, sir. So to move on to the next question, Nancy, can you move? Yeah. The poll, yeah. So based on this, we have the poll. What is your current practices mainly based on? So we have many embryologists in the group answering that. Everybody follows manufacturer recommendation, and very few of them will do internal validation about the changes in practice, and few of them follow the mentor or laboratory tradition. So what their mentor teaches, they are simply following that. So majority of the participants go with the manufacturer recommendation. It's happy that. So let us move on to the next slide. Nancy, would you like to take that?
Yes. Sorry, I had to leave in between. There was something important which came in. Drawing from your own clinical experience, have you ever observed a decline in the key laboratory or clinical outcomes such as fertilization rate, blastocyst development rate, or implantation that you genuinely attributed to the use of culture media approaching or exceeding its labeled shelf life? So have you ever seen that if you think that the media has been aged, that's why this patient is facing a decline in the fertilization rate or blasters development rate? Dr. Lote?
Yeah, it should not be possible to have a decline in the culture media as it is aging. And I can't imagine any lab would use media that has exceeded its shelf life, because it's established the shelf life through testing. So it's obviously not good anymore after shelf life.
So that's it.
I don't have any experience because in our practice, when it is approaching the expiry date, we don't use it. Hence, I don't have any data on that actually.
No, sir, it is not about expiring. It's about the label shelf life of opening, post opening the stability. It again comes back because the smaller centers, all the smaller centers, they face this similar issue that the volume is very less, and if they get the minimum 10 ml bottle also, it is going to be if you're doing only one case from it, there is a little you have to take a fetch on either financially or on this. So do you think that if we exceed the shelf life, post opening shelf life, I'm not talking about expired things. We are not, nobody, if industry is using expired,
There is no
nobody is using it.
established evidence, but we do hear people saying that you can still use it as long as you maintain the temperature, beyond a certain period of say maybe 1 or 2 weeks, beyond the expiry date. Having said that, but they will be doing at their own risk actually, because again, how long you have maintained the temperature, how often you have opened it, and how much the pH has changed in the media. All these things matter actually. But if you maintain the temperature and all these things, then probably in a situation where you don't have any other option, you could still use it.
Dr. Andrew, Dr. Lote, Vijay sir, any comments on this? Have you ever
This particular thing comes up basically, it usually affects, but the thing is that the particular thing comes up basically because of that urge to use the beyond shelf life medium. So you have already ended up into the den and you don't want the lion to attack you. So that's how it is. Ideal thing is, do not use it beyond its labeled shelf life, as per your institutional as well as the manufacturer's recommendations. Beyond shelf life, you should not be using it. If you tend to use it, you should be ready to face these differences in the KPI. If it comes up, do not just blame it on the media. check the other aspects also, because it is not only the media. In a small this one center what we are talking about, rest of the things like incubator would have been also switched off, many things would have changed. So how do you pinpoint it exclusively to the media?
Yeah.
It's practically not possible. The entire system is shut down and the entire system is started up, and you just try to pin it to the media is futile. But as a cautionary, this one, as far as the media is concerned, I say that beyond the label shelf life, do not use it.
So strictly adhere to the manufacturer's.
Manufacturer's recommendation, internal validation. The smaller the center, more validated they should be. Because if it is a continuously running center, you always have a cross comparison. And you have sufficient stocks in your place in order to make a change also, and to step in and to avoid it from getting sabotaged. But you have a standalone IVF center which is doing very less number of cases. You need to be much more careful rather than careless and try to cut corners in the cost.
Yes. So for this also, there is a very recent paper which was being published.
I think there is some network issue with Nancy. So there is a recent paper published on this regarding the culture media age doesn't affect the IVF outcome. So we just want to quote this here. And moving on to the next thing.
Just a moment. See, this is how the bias starts. Here, culture media age does not affect the IVF outcome. But beyond shelf life, if you use it, it definitely affects. So if it is not affecting, then it goes out to say that you can use it till the expiry.
Yes, sir. So
absolutely. Then all these questions doesn't arise.
Yes, sir. We have the discussion.
This is where I said internal validation, manufacturer's recommendation, both has to be considered. And if it is a small center performing lesser number of cycles, there obviously they will be having one very clear thing that if it is not only the media which will be switched off, even the incubators and the entire culture room is switched off. So it will be kick-started only prior to this one. And what all validations they have done before starting a particular case, we don't know. So you cannot pin it onto just media on that particular time.
Yes, sir. So that's why we have the discussion here. So shelf life is different. How you are handling is different.
Different?
Yes, sir. Thank you for your valuable inputs, sir. So we had a poll on this. Have you ever observed a decline in blastocysts that you expected was related to age culture media? So many of the participants have answered no. And in this, we have a few participants observed yes also. So we don't, I think they have answered based on their internal validation. So they have the data, I think, based on their experience, they have answered this. And see the last one, evidence.
Just a second.
Yeah. The next one and the next slide. We have finished the poll.
You have finished the poll. Okay.
Yeah. The next one. Next one.
So just after this, just the conclusion from and take-home messages from all our panelists. I just want everyone to say a few things. We know that temperature fluctuation should not be there. There should not be pH fluctuations. Stick to the manufacturer's details, and you have to follow that. And anything else, all of our expert panelists want to add as a take home for the delegates who have been joining, who are here with us today in the webinar. One by one, everyone can take.
Well, I'll start then by saying I think it's a great initiative for bringing people together and have more open discussions and sharing experience and knowledge. A great initiative. We did not touch upon oil, So that is an important factor for influencing what happens in the lab. And in our experiments, we've shown it can be stored at room temperature for a long time. What it is very sensitive to is light. So I recommend, if it's not going in and out of the refrigerator and stored in a dark places, that you wrap aluminium foil around it if you keep it out all the time. It's not so temperature sensitive, but it's very light sensitive. I see there's
Dr.
a question
Andrew?
in. Yeah.
Yes, ma'am, please.
Yeah, there's a question. So that's absolutely true. The bicarbonate concentration will be increased if there has been evaporation of the water from the medium, along with increased osmolarity.
Yeah, that was the question. So she's talking about the bicarbonate concentration in the media and observing the CO2 concentration. The question is about the same, about the possibility of change in concentration of bicarbonate due to evaporation of water, which can change the osmolarity as well. Yes, she agreed to that. Yes.
Yes.
We move to the next expert, Nancy.
Dr. Andrew, do you want to give some take-home message to the delegates?
I guess my take-home message would be to follow the manufacturer's instructions. You know, these companies spend tens of millions, if not 100 million, on developing these culture medias. It's not an easy thing to do in the clinical trials that they have to go through and the certification they need. They will know what is best for the individual media, not your colleague in the lab who's maybe got 10 years of experience or 20 years of experience and saying that's the way we've always done it. So always follow the manufacturer's instruction. And then I guess my other more personal take-home message would be, you know, it's not just the culture media, it's the oil, it's the air quality, it's the whole culture system, the incubators, the preventative maintenance, everything goes together like a jigsaw. And so culture media is just the first part, and I hope to see some of these topics covered in future webinars.
Dr. Suresh?
I think, as what the previous, speaker said, you follow the manufacturer's instructions. That is how to use the media, how long you use it, how to maintain. Having said that, when you receive the media, when you keep in your refrigerator, have you maintained and monitored the temperature? Suppose there is a temperature fluctuation, it can affect the media. For example, if there is a power failure, do you have an uninterrupted power supply to your refrigerator? Say, for example, you don't have one. In the middle of the night, there is a power whatever failure. Then the media is compromised. When you come in the morning, the temperature may show the same whatever maintained temperature, but that can also compromise. That is how you look after your media. Secondly, how you maintain the media actually in the incubator. What temperature you maintain and how do you look after that actually. So these are all things actually an embryologist should know how to also to understand what is the composition, what is the temperature, pH, all these things put together. I think embryologists should be knowledgeable how to handle it.
Vijay sir?
Be observant, diligent, and react fast.
Very well said. Sanjay sir, you're also here if you want to add something. As
No, many of us started IVF when there was just one single universal IVF culture medium. And we used to transfer on day 2 or day 3. But then arrived the sequential culture medium system. And we used to procure 3 different vials of 20 ml at least media. I'm coming to my original point is cost. Whether the cost in rupees or whatever money of culture medium is more important, or the cost of losing your patient, or the cost what they are paying for. So you have to be judicial. If, Dean Morbeck says there are more than 200 things that can affect your IVF, probably the simplest thing is to have a small volume of culture medium. It is the simplest thing, and very less, investment is required. You need to monitor, your pH. The pH probe has a shelf life. You need to change the probe again and again. You need to have a osmometer if you are very particular about monitoring osmolarity or osmolality. So all those fancy gadgets, you need to invest in that. And you are talking about the, small volume laboratories again and again. They cannot, if they cannot afford those gadgets, if they can afford to build a very good IVF laboratory, they can certainly afford a small volume of medium. So this is the simplest thing that can be avoided if you invest in this thing, rather than troubleshooting later on, which is extremely costly thing.
Absolutely, very well said, sir.
More like buying a ticket after the train leaves.
Absolutely.
So these were the questions which were mostly asked by the young embryologists who were there in the just joined the field, and they wanted to know more about it. So we wanted to have this conversation. We wanted to fit in their minds that these are the things which are absolutely important in the lab, and you cannot bargain with these things if you have to work in a very well set up IVF lab and you are expecting good results from it. That's why the session was meant to happen, so we can have conversation which people avoid usually, just thinking that this might not be the right place and right question to ask. So this was the idea behind today's gamete controversies. Now I would like to request Charu sir to please give the vote of thanks for our expert panelists. They were being wonderful during the panel, and we learned a lot of new things today, and a lot of old things also got refined.
So thank you, Nancy, and very good evening to all. And it is really a nice initiative, I think, which is taken place now. And I hope definitely, as Dr. Lote said, oil and other related constituents will also be discussed on this platform. So what I can say is that before I was just thinking of the question related with our discussion, and it was answered. So it was so wonderful discussion that most of us, what we are expecting out of it and what we are facing difficulties and all. So it all is taken care of and answered by our experts. So we will try to bring more and more experts on this panel, and we'll move ahead with this kind of discussion in future. So on behalf of iHERA, I would like to thank all of you for being here, sparing time for this platform, and given us opportunity to understand and learn about the media. Uh, in future, we'll definitely have more advanced discussion on the components of the media, and what is the strategy from the beginning, starting of birth of Louis Brown till now, what are the changes happened and all. There are so many things to be known as an embryologist to me as far as media is concerned. So I hope in future we will get back with this kind of information more and more on this platform. So once again, on behalf of iHERA, thank you all for being with us here on this evening. Thank you.
Thank you so much, everyone. Thank you for joining. Thank you for taking out time for today's webinar.
So I hope with this we are finishing up with this series. See you all in upcoming events. So thank you.
Before we end, just a small announcement with a comment, if I'm allowed to, is that we must understand, especially the younger generation, that what we have learned today is not just the users and senior embryologists, but from one of the person, Dr. Lotte Strubeck, who has the first-hand experience in producing the IVF culture media. So this is not just from the IVF laboratory, but from the perspective of a media production company. So you are very lucky to learn from the expert like Lotte. Another thing is, which is very important, that we have, the iHERA has joined hands with IIT Hyderabad and LIVA, the Life in Vitro Academy, for the practical hands-on training for the embryologists who want to learn the nuances of embryology. And they have very reasonably priced training sessions. So if anyone is interested, they can contact directly to any one of us at iHERA or at LIVA in Hyderabad. So with that, I would also like to thank our academic partner, Corona Remedies. Thank you very much.
No. Thank you everyone. Thank you, Dr. Lotte. Thank you, Dr. Andrew, for taking out time. Thank you, Dr. Suresh. Thank you, Vijay sir. Thank you, sir. Sanjay sir, Charu sir, everyone. Okay.
Thanks, everyone.
Okay,
Please see
take
you all.
care, everyone.
Good night. Have a great
Thank you.
weekend.